Hi, I'm Dr. Sheila Lee, and I'm here with Simon from Sinclair, and we're going to be talking about Ellanse.
Hi, Dr. Sheila. As you know, I'm Simon from Sinclair. As you know, Ellanse is one of our trademark products, but we've also got many other products in our portfolio. Sinclair's been around for over 50 years. We have another collagen stimulator, which is a thread for the face called Silhouette Soft. We also have Miley, which is our brand new HA filler. We also have Lanluma, which is our filler for the body, a PLA, and many other products to come.
I've been using Ellanse for more than 5 years, and I'm also recognised as one of the UK experts. I also train other clinicians on how to use Ellanse. I get a lot of questions about the safety of Ellanse. It's one of the, with anything that's been injected into your face, the first thing you're going to want to know about is it safe? So is it safe?
Yeah, it's really safe. I mean, Ellanse's been around since around 2009, so it's around 12, 13 years old now. We've got various different licenses all around the world we've got. So 2013, I think it was, we got the Korean FDA. I think it was 2018, we got the Anvisa for Brazil. We launched last year in China, 2021, with the Chinese FDA as well. And now this year, I think it's nearly just over 2 million syringes we sold. So it's a very, very safe product. Loads of people use it, like yourself, all around the UK and Ireland, but also the rest of the world.
Wow. I mean, the Chinese and Asian market is a massive market for me. And I get a lot of patients that want Ellanse. They're coming in and they're asking me for Ellanse, and with these patients, I'm doing a lot of treatments in their upper face and their mid face. We're doing a lot of beautification treatments because it's very different in the Asian market versus the Western market. Yes. Now, one of the things that is different about Ellanse is it's not a HA, is it? Yeah. And can we talk a little bit about that?
Yeah, of course. I mean, I don't want to get too technical because I'm sure your patients who want to know about the product want to know it's safe, and like we talked about, that it works, and it does, obviously. But yeah, it's slightly different to an HA, so it's slightly different makeup. There's two parts to it. So without getting too technical, it's like PCL, which is polycaprolactone, that's one bit, which is the collagen stimulating sort of microspheres. We've also got the CMC gel, which basically gets those microspheres to the right place where they need to be to stimulate that collagen stimulation and get that really nice result, which obviously you get all the time.
Yes, absolutely. And you know what? I'm going to talk to you about the collagen stimulation, because for me, the collagen stimulation is one of the second part of this product that makes it fantastic. Obviously, when we inject the Ellanse, we get that immediate volume, and we can use that to structure the face. And then we get this amazing collagen. Now, the collagen stimulation happens over a 3-month period. So we know that this is the ideal time to review the patient, but this is when their results are going to be optimum. So in patients who are, say, for example, with my patients, they're a bit younger, so that I would always undertreat. One of the questions that I get asked is, because we can't remove the Ellanse like we do with HA, one of the things that I want to talk about is this. But before we talk about this, I want to go back onto the collagen stimulation, because it's one of I think, the most magical parts of this product.
Completely agree with you, yeah.
So with that, we know with the collagen stimulation, as I said, it takes 3 months to realize the full result. And what happens in comparison to HA, we know, is that it then holds and that result is stable for 2 years if I'm using Ellanse M. We know that there's Ellanse S and Ellanse M. I mostly use Ellanse M.
And to be honest, most people do, because I think they want that longevity, and I think your patients want that too. So you're completely doing the right thing.
Yeah. And longevity, we're definitely getting it, and it's completely different to HA because we're getting 2 years from the Ellanse. And what happens with the HA is, as soon as you inject it, it's slowly broken down. So it gets broken down over a period of time. And the collagen stimulation is what's giving us that longevity, isn't it?
Yeah, completely. It's all about the collagen stimulation. That's what Ellanse is all about. So I think if people are using Ellanse, it's that collagen stimulation. It's that skin quality as well. I'm sure your patients say that to you.
It's one of the greatest things about Ellanse that I get from patients all the time. They come in and they say, "Oh my God, Dr. Sheila, look at my skin. It looks so much better. It looks amazing. It's glowing." And that is because of the collagen stimulation. So that is one of the things that makes Ellanse really, really unique.
That's one of the things why I absolutely love my job, to hear stuff like that, saying that your patients come in going, it's like the tone, the texture, the quality of your skin. There's nothing better for me, working for Sinclair, when we know our products are doing so much benefit for the people out there who are actually getting those treatments done.
That's amazing. So let's go back to talking about the HA. So that's your hyaluronic acid and Ellanse. One of the biggest concerns, we all know that HA can be dissolved, okay, and Ellanse can't. For me, that's one of the concerns for my patients. For me, it's not a problem, because actually when we do Ellanse treatment, when we do any treatment, we always have to assess the patient. We need to make sure that the patient is the right person for the treatment, we don't need to dissolve it, because you will have always done a full consultation, and we will have made sure that it's the right treatment for them. In a younger patient, we would undertreat, we would slightly under-inject, and then we would see you again at around about 3 months. And at 3 months, we would decide whether we need a little bit more. So actually, there isn't any need to remove it. And even if we were to, we would do the same process as hyaluronic acid anyway, in the first couple of weeks. So it's not, for me, it's not a big concern. What are your thoughts on that?
I completely agree with you. I think you said, firstly, start off with a consultation. That's the most important thing. It's about finding out about your patient, exactly what they want, but also putting your aesthetic eye in there in terms of what they actually need too. I think bringing them back after 3 months, we actually see that result, really important too. But just to let you know, in terms of actual sort of side effects with the product, with Ellanse itself, less than 1%, which works out about every 1 in 2,000 patients, or just over 2,000 patients, would maybe get a side effect, but you don't know. It might not happen as well. But like you said, there's ways to deal with that if need be. It's probably a standard side effect you'd see with any normal HA treatment as well, which I'm sure you do.
Absolutely, yes. So, the side effects that you can get, it doesn't matter what we're injecting. We could be injecting Miley, we could be injecting Ellanse. Side effects with dermal fillers are the same, no matter which dermal filler you use. I mean, Ellanse is just another dermal filler, a fantastic, just another dermal filler, a great one. And things that patients will ordinarily see with any injection, things like redness, bruising, you might get a bit of swelling, and it will feel uncomfortable afterwards, but that's completely normal, and we manage that. We can reduce the risk of side effects by seeing someone that's really, really experienced.
Yeah, completely. And I think seeing someone like yourself goes back to that consultation. It's about talking to the patient about that as well, so they know exactly what may happen, because that's really important for them to know. But it's having to have the product in the right hands, for me, is the most important thing.
So Simon, according to Sinclair, what are the official areas that we can inject Ellanse?
Officially, you can use Ellanse all over the face, so full face rejuvenation. You can't use it in the lips though, you can't use it under eyes, and you can't use it in sort of frown lines there as well, but everywhere else, absolutely fine. Obviously I travel up and down the country for UK and Ireland, and I see people using it all over with some amazing results, but I'd be intrigued to find out, where do you like to really use Ellanse in your patients?
I'm a massive fan of full face rejuvenation, so I love using it in the full face. I treat all different types of patients. I have a big Asian and Chinese demographic, and in these patients it's slightly different. As I mentioned earlier on, we do a lot of sort of upper face beautification. We do a lot of upper face beautification, where we're treating the temples, the cheeks, we're refining all these areas and balancing the face, and it's fantastic. I often, no patient is symmetrical at all, are they? And occasionally I will get a patient that's asymmetrical. One of the things that patients might worry about is the collagen stimulation. So they always say, if you inject more on this side, Dr. Sheila, because I'm not symmetrical on this side, am I going to get more collagen stimulation? Well, the one thing that I always say to them is, the great thing about this project is that you get to see the results immediately, okay? And it's quite consistent with how much the final result's going to be, give or take maybe 10%. But because we're injecting it more on one side, yes, you will get more collagen stimulation on one side, but you need more on one side because it's asymmetrical. So it's not something that you need to worry about as a patient.
Completely. And I think it's, again, in skilled injectors' hands, and we only ever train, as you know, you're one of our trainers within the UK and Ireland, and we only give it to skilled injectors. They've had a lot of experience before they start using Ellanse. So you're right in terms of that profile balancing, but there's things you can do, and those hints and tips, I suppose, the tricks which you can use to make sure you get the best from that product.
But it is, it's safe, it's effective, and the results are phenomenal. And most importantly, the results last a really, really long time. And if patients want to find out more about Sinclair and the products, where can you get more information from?
Best place, first point of call would always be our website, which is www.sinclair.com.
And they can get all the patient information on there.
Lots of information on there, all about Sinclair and all about our brands as well.
Brilliant. Thank you so much for your time. Thank you for coming in. Thank you for supporting our clinic. It's been amazing to have you here.
Oh, you're welcome. I really loved it today, and hopefully I'll get invited back to maybe talk about some of our other brands.
Yes, absolutely. Well, we can definitely talk about Miley and Silhouette Soft Threads, two products I absolutely love, how we can use all these different products in a patient that may come and have lots of different areas that they might want to treat. So yes, let's do that.
Amazing. I look forward to it. Thank you so much.
Thank you.